Rheumatoid arthritis affects 1 to 2% of the population. It's an autoimmune disease where your immune system is attacking your own joint lining. There's tremendous amount of inflammation in that disease. Patients typically present with lots of pain and swelling in their joints, morning stiffness. Typical age of presentation is between 20 and 50, but we see patients even older than 50 that can present with this disease. We don't know the exact cause of the disease. We know it's somewhat driven through the genetics, but there's also environmental components that turn these genes on. Once the disease is turned on, it's a chronic and very rapidly progressive disease that can lead to joint damage very fast. And if it's not treated quickly enough, it can lead to disability. It can also lead to increased morbidity and other organs being affected with this inflammation, even the lungs, eyes, heart disease. Mortality risk is also high with rheumatoid arthritis patients. It's more common in females than males with a 3-to-1 ratio. As far as diagnosing it, the history and exam by far is very important. Labs and x-rays help us also to confirm the diagnosis. Once the diagnosis is made, it is very important that we start patients on proper treatments. And the sooner we start these medications that control the inflammation from the immune system, the better the success for the patients in preventing joint damage. In the last decade and a half, there's been tremendous research and new developments of targeted drugs, which are called biologics. We're utilizing those agents early on in right patients. Our goals now are remission. As much as possible, we want to shut the disease as quickly as possible. Disease-modifying drugs are the old drugs that we still use in rheumatoid arthritis treatment. But a lot of times we come across patients who have very severe disease and we combine old drugs with new drugs. But regular follow-ups and monitoring, making sure that they're on the right combination that's working for them. And safety is, of course, at the end very important also as we prescribe these high complex medications.